so much of what happens in public health is unknown to the public. And
Yes.
it's kind of designed this way because it's also a paradox. And you talked about this in 2020 fairly publicly. When things are going right, nobody even knows that you're there, right?
Yes.
And then you have to fight for funding because you're doing such a good job that nobody thinks that there's a problem. But when there are challenges, you're in the spotlight and you can become the target of blame or even worse. So what do you think people would be surprised to learn about in those early months? Things that if they had known, especially when things got really nasty, that might have changed their thinking or even our behavior as a state.
Well, we have to understand that even in 1918, I had pictures from Cleveland of anti-mask societies. This was going to be a difficult thing for all of us to get our head around, myself included. That said, my very first testimony, I had a year as director of health before the pandemic hit. My very first testimony, you go in front of the legislature and you're supposed to read your budget, which was like about $1.6 billion budget in public health. It's a bunch of numbers and zeros and nobody pays attention. And I remember thinking, how are they ever going to fund something they don't even know what it is? And I think most of us don't know what public health is. So I went off script for the first time and I said, when I do my job right, when I knock it out of the park, it is the silent victories of public health. You don't see it and therefore you don't fund it. What people don't realize is, look, I'm a physician, but I'm also a physician in preventive medicine in addition to my master's in public health. And everything I learned in med school accounts for only about 5 of the 30 years we live longer in the last century. When my grandfather was born in 1900, the average life expectancy was in the 48 to 50. Some people luckily lived longer, but that was on average. We think of people like Thoreau, did all his great work and died by the age of 48. Of those 30 years, 5 of those years are due to the really high technology things that we all need some of the time. But the other 25 years came from things that we can only solve collectively. Clean water, safe food, child labor laws, highway safety laws, how planes fly. And not only that, but the things that affect our health don't just live in the Department of Health. The governor had me sit in on every budget because health was everywhere in all the cabinets. It was in transportation budget. It was in commerce budget. It is obviously in Medicaid and mental health and aging. And so these things that we all don't see are absolutely essential conditions for us to be well. And we got one of the best budgets in history, in near history, did some great work, even with this legislature that we see as so politicized. Because once I met with every legislator, turned out they loved something in public health. They just didn't know it was named that. Yeah. They might like home visiting. They might like getting rid of lead in pipes for children in Cleveland. They cared about all sorts of issues like harmful algal blooms that were closing their lake in their community. So it's here and we don't see it.